Welcome back. You are watching End Time TV's On the Edge. This hour we're doing an internal medicine show, and we are picking up from last week. We were talking a little bit about endocrinology. We had some material that we wanted to cover in that first section. With me today, Dr. Doron Feinsilber. However, for the remainder of the hour, we are going to be talking about RSD. That's Reflex Sympathetic Dystrophy, CRPS, Complex Regional Pain Syndrome. And I had an opportunity to speak with the chairman of the Scientific Advisory Committee for the RSD Foundation, Dr. Anthony Kirkpatrick, this morning, briefly by phone. And I wanted to read this from their website. This is the preface to the third edition of the Clinical Practice Guidelines, and says the Clinical Practices Guidelines have become a standard for managing RSD CRPS. As with prior editions, my intentions, referring to Dr. Kirkpatrick, have been to focus on providing healthcare providers and patients with unbiased information that will enable patients to make informed choices about their treatment. I want to skip down here. The most notable addition to the third edition is a new section titled RSD in Children. During the course of preparing this section, it was necessary to consult extensively with experts in the field of pediatric pain management. I do want to mention that reflex sympathetic dystrophy syndrome is also known as complex regional pain syndrome and is a multi-symptom, multi-system syndrome, usually affecting one or more extremities, but may affect virtually any part of the body. Although it was clearly described 125 years ago by Drs. Mitchell, Morehouse, and Keene, RSD, CRPS, remains poorly understood and may go unrecognized. This was brought to my attention mere days ago when a gentleman approached me asking about his daughter, who had had a local injection when she was age 3 of a vaccination. She subsequently had a great degree of pain in that extremity, and over the next 11 years developed multiple symptoms, pain throughout her body, especially in her upper torso and in her abdomen. And ultimately, this was diagnosed as RSD. He asked me, what do you know about this and what should I be doing? And my response was, in clinical ophthalmology, I never ran into this disorder once. So I had to go to the internet myself and take a look at this process. And it is an incredibly complex set of symptoms and diagnoses, and it's so challenging and apparently so common that I thought it would be important to my viewers to be able to hear a discussion of this. So we want to pick up with that conversation, Doron.
Yeah.
And I wanted to start by asking if you would talk a little bit about a typical patient. You mentioned that you could talk about someone coming into your clinic and you have to do a differential diagnosis. What are we finding?
Well, first of all, before I continue with that, I'd like to say that I'm very impressed with how eloquent you're able to capture the essence of what RSD is actually about, because the issue of pain is a very personal one to patients. And a lot of times, they're very embarrassed to say, doc, I have all these issues, I'm in the hospital, and they don't even have a clear understanding as to why this is happening. And that really gives me a time that when myself as a doctor, I can say, well, I need to spend time with the patient, try to figure out exactly why they're having these issues, know what the source of that is, and create a differential diagnosis in order to determine that. Now, reflex sympathetic dystrophy, I've personally read a bit about it, but you're right, a lot of the standard clinicians have never thought about this before. It's not one of your standard, types of syndromes, and we call that in medicine a zebra. What it means is that, usually the most obvious reason for pain is going to be, that's usually what it's going to be. Is that, if you think of if I tell you, oh, my elbow hurts, I probably fell on it. It's kind of common logical dictate that. What makes this more difficult is that the way we actually go about diagnosing these types of syndromes is not your standard practice. Now, now, if I have a typical patient that tells me, doc, I'm really hurting my shoulder, and actually a lot of patients who have RSD tend to have shoulder pain. Usually upper extremity pain is where a lot of this is involved. And I'll say, well, usually I say, well, did you fall? And of course they say, no, I haven't had any trauma, and it gets frustrating. So I start thinking to myself, what is it that needs to be addressed first? I create a whole list of things it could be. So first of all, I say, well, is this person are they truthful in what they're telling me? Because a lot of patients do have a benefit to playing the sick role in the hospital when they really don't have anything.
And apparently, a lot of these patients, by the time they're in the treatment process, are looking at some legal action. We are going to commercial break, by the way. Let's pick this up. We'll be right back. You're watching In Time TV's On the Edge, Conversations in Internal Medicine. I'm Dr. Jonas Moses. With me this hour, Dr. Doron Feinsilber.